All right, welcome back. Here I have Buzz's leg removed from Buzz's body. So again, I can manipulate the model a little bit better. It's pretty big, so I'm not gonna be able to show the whole leg all at one time, but that's okay. We'll still be able to move through these muscles. So the first one on the list is actually a combo muscle. It's called the iliopsoas. It looks like iliopsoas, but it's a silent P, so it's the iliopsoas, made up of what's called the iliac major, or the iliacus, and the psoas major. So this part of the model here is going to be our iliopsoas. So it originates on your iliac fossa, right? So that's that big dent here, and a little bit on the last thoracic vertebrae and your lumbar vertebrae. Inserts on the lesser trochanter. Again, there's so many muscles here, I can't show you that part on the bone, but you should remember your lesser trochanter. And it helps to flex the thigh at the hip. So flex, imagine, lifting your leg up in front of you, okay, like a flex. It's gonna bring it up like this. That's your iliopsoas. The next three are our gluteus muscles. We can only see two on this model. One of them is too small and you can only see it on a picture. But the big one here is our gluteus maximus, that's our butt muscle. It originates on the iliac crest, sacrum, and coccyx. So kind of all along here. And it inserts on the femur and iliotibial tract. So this big kind of connective tissue here is called the iliotibial tract. So you see a little bit of those fibers kind of blend in. So that's insertion. And what your gluteus maximus does is extends and laterally rotates your thigh. So if your iliopsoas flexes, think of your gluteus maximus as extending. So that's gonna be straightening your leg, like stepping back down. This muscle works really good when you're walking up steps or walking uphill. It is your major leg, your hip extender. Then we have the gluteus medius. Gotta take the maximus off. Here we go. So then we have the gluteus medius here. So the gluteus medius originates on the iliac crest and inserts on the greater trochanter of the femur. Gluteus medius helps to abduct and medially rotate the thigh. And the gluteus minimus is going to be even deeper to this. I can't show you on the model because we don't have it. It originates also on the ilium, also inserts on the greater trochanter, and also abducts and medially rotates the thigh. So your gluteus medius and minimus are very similar. Your maximus has a lot more work with extending and laterally rotating your thigh. Okay. On to the next page. The next muscle is this little band here. It's number 7 on this particular model. It's called the tensor fasciae latae, or latae. I always call this the coffee muscle because it kind of sounds like a latte, but it's only got one T. So sometimes you also hear it called the TFL, tensor fasciae latae. It originates on the iliac crest and the anterior superior iliac spine. So remember that was one of our markings on the bone list. It inserts into this iliotibial tract. Okay, this big band, sometimes called the IT band. You might hear that if you do any physical therapy. It's got a lot of jobs to do. So it flexes and medially rotates the thigh, and it helps to, when it tenses this fascia, it helps to laterally support the knee. We can see that TFL, the muscle up here, that IT band, the iliotibial band, goes all the way down past the knee. So it helps to support your knee joint as well. Next, we have our adductors. And again, we can only see a few of those on this model. Your pictures are gonna be a lot better because they're very deep and we just can't see some of those deep muscles. I'm gonna take this guy off here. So we have our adductor longus, is this guy right here. Adductor magnus is this one here. And adductor brevis we cannot see on the model. So your adductor longus originates on the inferior ramus of the pubis, inserts to the back of the femur on the linea aspera, and helps to adduct, flex, and immediately rotate the thigh. So these are your major adductors. It's gonna help bring your legs back in towards the midline. Your adductor magnus, also inferior ramus of pubis, and begins at the ischial tuberosity. Also inserts on the linea aspera of the femur, also adducts, flexes, and immediately rotates the thigh. And then your adductor brevis also originates on the inferior ramus of the pubis, inserts on the linea aspera of the femur, also adducts, flexes, and immediately rotates the thigh. So that's really nice. All your adductors insert on the same place and they all have the same action. And mostly the origin is the same. So they all originate on the inferior ramus of the pubis. It's just the magnus also includes the ischial tuberosity. All right, so those are muscles of the hip. That wasn't too bad. I will see you next time for muscles of the thigh.